I think next we have a video to play for talking about side effects of medications from Susan Horsman. So if our AV team can bring that up. Susan Horsman, many of you may have met, is a new neuroimmunology specialty pharmacist who's joined our practice, and she does both in-person and virtual visits, and has been a really helpful resource to us to guide people on side effects of medications, vaccinations, side effects and interactions with other medications. So she'll touch on that a little bit here. So hopefully we can play the video.
Hi everyone. I'm sorry I'm not able to be there in person, but I am hoping to talk with you today about side effects that are possible with medications we use for MOGAD and how we might manage them. My goal here is to not sound like a commercial on TV that lists, what seems like every possible side effect, but to really highlight the most common ones that we see and a few rare ones that have specific recommendations for monitoring or ways to reduce risk. I'll start by talking about medications that are taken by mouth, which includes azathioprine. Knowing that the goal of many of these medications is to quiet down the immune system, there is an increased risk of infection that comes with that. We will come back to that at the end of the presentation to talk more about ways to reduce risk. Azathioprine can also cause some nausea, vomiting, and diarrhea. Oftentimes, people report that taking it with food or taking the dose at night can actually help with this if it's something that you experience. We may also see a few different changes in lab values, including increased liver enzymes and low blood counts, such as low white blood cells, red blood cells, and platelets. With this, we typically will do routine lab monitoring and make dose adjustments if necessary. I've also had some people that notice joint pain or fatigue. And finally, although very rare, there is the potential for a small increased risk of skin cancer. So we do recommend a yearly skin check with a primary care provider or dermatologist, and then of course using sunscreen and protective clothing while outside. Next is mycophenolate, which again carries that increased risk of infection. And also similar to azathioprine, it can come with some nausea, vomiting, and diarrhea. This tends to be most common in the first few weeks of starting the medication as the body gets used to it. So we typically will recommend starting it more gradually and increasing the dose over a few weeks to help with this. Mycophenolate is best taken on an empty stomach to help the medication be absorbed into the body. However, a lot of people find that they do need to take it with food to help with some of the GI symptoms, and if that's the case, that's totally fine. We do monitor labs for low blood counts and make dose adjustments if needed. A little bit unique with mycophenolate is that unfortunately it has been associated with birth defects and pregnancy loss, and so there are some special considerations as it relates to family planning. In females of reproductive age, contraception is required during treatment and for 6 weeks after stopping the medication. In males, contraception is also recommended during treatment and for 90 days after the medication is stopped. Similar to azathioprine, we do still have that potential small increased risk for skin cancer, although rare, and so the skin checks and sunscreen, protective clothing, things like that would also be recommended here. Prednisone and methylprednisolone are two examples of steroids that can be used for MOGAD. Side effects here can vary depending on how long we're using the steroid for and the dose as well. So a few things that can happen with short-term use would be trouble sleeping, as steroids can be quite activating. So I typically recommend taking that dose in the morning to see if that helps. In addition, we can see a little bit of stomach upset, so taking the medication with food to help protect that stomach is also recommended. Mood disturbances are possible, so irritability, a little bit of anxiety, maybe some restlessness um, are somewhat common. And so kind of monitoring for that and discussing it with your provider if it bothers some or if you notice changes. There are a few additional side effects that can occur with long-term steroid use, such as decreased bone health. For this, we recommend taking a daily calcium with vitamin D supplement with at least 1,000 milligrams of calcium and 800 units of vitamin D. A bone scan may also be done if steroids are used for 3 months or more, just to check in on bone health and address any concerns that may be identified, including osteoporosis. With the infection risk that comes with steroids, there is one unique consideration in that if a person is on prednisone at doses of 20 milligrams or more for greater than a month, this is when we will often add in an antibiotic to help reduce the risk of a particular type of pneumonia. We do try to keep an eye on the eyes as well. So thinking of having that routine eye exam just to catch any concerns for cataracts or glaucoma that might be seen. A few more considerations with long-term steroid use would be the potential for increased blood sugar, blood pressure increases, and the potential for swelling or fluid retention. Oftentimes, this is most impactful in people that have, a history of diabetes as an example. So we do try to monitor closely and make adjustments to medications if needed. We can also see increased appetite and weight gain. So really important to keep a healthy diet and exercise in mind there. Rare, but we do occasionally see stomach ulcers. So we can prescribe medications to help decrease stomach acid. And then avoiding regular use of NSAID type medications such as Aleve or Advil, unless it's recommended by your provider, can also reduce risk. Acne can also be seen, so this would be something to discuss with your provider, as there may be additional medications that can be used to treat this if it's bothersome. Next, we'll move to some of our infusion or injection-based therapies, and starting off with tocilizumab. This can come with that increased infection risk, of course, and it is available as an intravenous infusion as well as an injection that goes under the skin. So you can, or we see potentially infusion or injection site reactions possible, and this is another potential side effect that we'll come back to at the end of the presentation to talk more in detail about. When it comes to lab values, we can see increased liver enzymes. This, however, is often mild and temporary, so typically we just kind of keep an eye on it, but in some cases it may require dose adjustments. Increased cholesterol can also be seen, so we recommend getting a lipid panel 4 to 8 weeks after starting treatment just to check in on how things are going. And then we will also just recommend monitoring blood pressure, especially in those that have a history of high blood pressure, to make sure that there aren't any worsening concerns there. With immunoglobulins or IVIG, we can see infusion reactions with this. Headache during the infusion itself is also somewhat common and is related typically to how fast the infusion is being given. So if this does occur, we recommend slowing the infusion rate down to see if that helps. Otherwise, abdominal pain and nausea could be possible. And a few rare things to be aware of would be a very small increased risk of blood clots. So having good hydration before the infusion can help decrease the chances of this happening. Kidney injury is also rare but possible, so again, good hydration before the infusion is recommended, and we can do lab monitoring if there are concerns in a particular scenario. All right, when it comes to rituximab, a few things to note here would be again that increased risk of infection. Immunoglobulin levels can also be lowered with treatment. Immunoglobulins are part of the immune system that can help recognize and target bacteria and viruses. So if these levels are too low, it can mean a higher risk of infection. So we will check these labs just to see how things are going. Infusion reactions are possible, and headache and fatigue, particularly in the day with around the infusion, can occur. So returning now to infusion and injection site reactions. These reactions are not necessarily an allergic reaction, it's more the body getting used to the medication. So we often will see these improve or resolve with repeated doses of treatment. But when it comes to infusion reactions, these are described as flushing, itching, tickling in the throat, maybe some chills, and in more significant cases, changes in heart rate or blood pressure. Medications can be given prior to an infusion depending on how likely infusion reactions are, and these medications would include Tylenol, Benadryl, and a small dose of steroids. Good hydration can help reduce the chances of infusion reactions from occurring, and if they do occur, we can slow the infusion rate down or pause the infusion until symptoms resolve before restarting. When it comes to injection site reactions, these are described as, pain, redness, swelling at that injection site, maybe a little bit of fatigue, fever, chills, or body aches. For local reactions at the injection site, a cold compress can be used to help improve symptoms. And sometimes people will also take a Tylenol or Benadryl 30 minutes prior to their injection. And then taking the dose at bedtime can also help with that, as you can try to sleep through some of those potential symptoms. When it comes to infection risk, this really depends on the person. Oftentimes people will tell me that they don't notice a change at all from their baseline. Other times people will notice that they, maybe get sick more often with like a cold or sinus infection. Maybe they have the illness hit them harder than they're used to, or it takes them longer to recover from. Ways to reduce risk would be to have good hand hygiene, avoid sick people when possible, and then vaccinations. I've listed a few things here that we often will screen for. Um, when on a medication that impacts the immune system, people are typically eligible for a few more vaccines than they otherwise would be. So it's important to talk with your provider or pharmacist to see what might be recommended in your particular case. To finish up with a few final thoughts, of course, medications can have side effects, but they are not experienced by everyone. And chances of side effects occurring can often be decreased or managed if they do occur. So if you have any concerns about potential side effects or side effects that you think you might be experiencing, please do not hesitate to reach out to your provider or pharmacist to discuss this further.